Welcome back to my channel. If this is your first time joining, I'm your patient advocate Monica. And before I get started with today's video, don't forget to click the subscribe button on the right hand side to stay updated on the things that I'm doing. And especially because this Saturday I am going live on my YouTube channel. I'm excited about this weekend's event because this event was inspired by my medical team and some supporters that have reached out to me about certain things concerning sickle cell. So I'm so excited to share the information because I've done a lot of research, and the best part about it is I'm gonna have to condense all of my research into 90 minutes or less, because there's gonna be a section where people can ask questions. So I know what you're thinking. So Monica, what is this event? The name of my event is called It's a Family Thing, and you can learn to understand it. Most family reunion shirts say it's a family thing and you won't understand it. Like my shirt says it's a Rockwell thing, so you won't understand it, or it's a Harris thing, so you won't understand it. But this family reunion, you can learn to understand it. And the first thing that I'm going to talk about is the different variations of sickle cell. And one of the things that I'm going to talk about, because one of my mentors was giving me advice, and his recommendation or his request was, well, Monica, you always talk about the sickle cell disease, and I noticed you never talk about the sickle cell trait or what it means to be a carrier. So this week, and we're going to talk about what it means to be a carrier. And people that are a carrier or have the trait, there are still some health issues that come along with having the trait or being a carrier of sickle cell, and we're going to talk about that this Saturday when I go live. The next big topic is going to be about the cures. And one of the things that I've researched and looked more into was everybody was talking about the 60-minute interview that aired on CBS that Dr. LaPook did, Dr. LaPook and Dr. Julie Cantor. And they're a part of the National Institute of Health, and they were talking about how HIV is one of the cures for sickle cell. So we're going to talk about that in more depth, about what it means that HIV is the cure for sickle cell. So what does that mean? And we're going to talk about it. And I want you to consider this before we get to Saturday. This is still in the clinical trial phase. And so they're still working the kinks out. But the good thing about the HIV virus that they've done tests on, that the biggest thing about the HIV virus is they have to weaken the virus before they insert it into a sickle cell patient. But we're going to talk about that Saturday in more depth. I'm just giving you little tidbits about Saturday. I'm not going to give you everything. So we're going to talk about that. We're going to talk about what they mean when they say there's a cure for sickle cell, because a lot of people have sent me emails, text messages, and inboxed me and everything on social media, my email and everything, and it was like, Monica, you can be cured from sickle cell, so you don't have to talk about it anymore, and so you don't need to talk about it, so we're going to talk about the cure. What does it mean to have a cure for sickle cell? We're going to talk about that. I'm excited about that. And the question that's going to be answered at this event when I go live Saturday is, will Monica go for the cure, or if she won't go for the cure? We'll find out this Saturday. So, and another thing that we're going to talk about that I'm so excited about, and I'm a patient for, and it's a service that I love, but there's a misunderstanding of what telehealth is. Telehealth doesn't replace anything. It doesn't replace the medical community. All it does is enhance your healthcare service. And I'm going to go into more in depth about that. And we're going to talk about what telehealth is and what telehealth is not. So you want to stay tuned for that, and you want to be connected with me and already subscribe to my YouTube channel. So when I go live Saturday, you're going to get that alert that SWGA Sickle Cell Awareness is going live at 11 a.m. Eastern Time. So be ready for that. And I think it'll be like 7 or 8 o'clock California time. But the good thing about going live is that later you can watch it. So if you don't get a chance to watch it Saturday, you can always play it back because it's going to be on my YouTube channel for constant review. So you can review it and review it and review it again and refer back to it. And so it's going to be a good event Saturday. And I'm looking forward to people asking me questions in the chat box. And I'm looking forward to talking to more people about it, getting their perspective on it. So, and getting feedback. I'm so excited about that. But don't forget to subscribe to my channel. Don't forget to share my videos. And most importantly, don't forget to like my videos. So, I'm looking forward to everyone chiming in on Saturday on my YouTube channel. And my goal was to have 100 subscribers before Saturday, but it's okay. Who's there is meant to be there. I believe that, and I'm thankful for the people that have already subscribed to my channel. This is your girl, your patient advocate, Monica, and I will see you Saturday. Goodbye.